I'm just trying to get a sense of what it's like in Sub-Saharan Africa and more importantly, where you are in Nairobi under COVID-19.
The situation is far from over, and we fear we could face a total lockdown. Already some areas recording high cases are facing movement restrictions. The government immediate measures actions on strengthening the health systems, which faces an extraordinary challenges to contain the spread of the COVID-19.
What equipments and systems are you and your team responsible for in Kenya?
Okay, in Kenya, we are responsible for the whole modalities. Now we have different people trained on different engineers trained on different modalities. Like now for the ICU, we have ventilators and the monitors. Now we have engineers who are specialized on that. We have here in Kenya. We have also engineers who are specialized in theater equipments like OEC 9900 and the rest. And also we have the radiology department, which have the X-ray sections. And also we have now in the CT scan, the MRI. Now I belong to that section. Now that's all. We have all the people now trained in Kenya for different modalities.
How many hospitals do you have to service, both public and private? And how big is your team in order to do that?
I can say maybe roughly 20 hospitals. But the clinics, I don't count the clinics. So my team is, I have three teams, 3 engineers who are based in Eldoret. We work for the whole region of East Africa also. Like me, I support other regions, like now in Tanzania or in Uganda or in Ghana or Nigeria. I go there for installation of ceiling suspended.
And Jeffrey, what have been some of the biggest challenges that you've had to face? I mean, there are travel restrictions, aren't there, for example?
One challenge I got is when the COVID-19 was announced in the country, that it was reported in the biggest referral hospital in the country. So I was dispatched as an FE to go and fix an X-ray machine, which actually is used for X-ray diagnosis. So this machine actually does 250 patients per day. So you can imagine the pressure that was there in the hospital and also with us as the company to send somebody as urgently as possible. So when I arrive in the hospital, I wear my PPEs as recommended by the EHS. There is a protocol which every week there is a communication between us, FEs in the field, because we are in the front line, and the EHS team. So they provide a protocol that we are supposed to observe.
How hot is it over there and how humid is it over there at the moment? And what were the conditions like?
Well, it was, the temperatures was not that bad. It was like, I think, 25 degrees that day. But actually the pressure of wearing the PPEs was actually what, even about hearing alone about the COVID-19.
How difficult is it to work in PPE? It's not something as a field engineer you usually put on. So how difficult is it for you?
It's very difficult. You will sweat a lot. You are not flexible. You cannot bend enough. As engineers, we like bending a lot. We open things on the base of this is a system which is a ceiling suspended system. We are trying as much as possible to make sure that every FE that visited any hospital, safety comes number one.
How do you think COVID-19 will have shaped the way you work?
I no longer go out to the hospital and shake somebody's hand. I'm no longer going to keep. I'm trying to keep that distance with the users to protect myself. And also, when we are working now on the systems, we try to make sure that they clean the systems before us. They do the sanitation before us. Now it has changed a lot, even the tools we are using, even the interaction we are having with everyone, even on the road, on everywhere we go nowadays, it has changed our lives completely.
Jeffrey, thanks for talking to me today and thanks for sharing your story, and please be safe.